Hello everyone, you all are welcome to lecture number 1214, and today's topic is main causes and symptoms of mouth cancer and its preventive measure. So if I say mouth cancer, commonly people call it oral cancer, and there are some causes. When we are talking of causes, main causes people are saying, even the doctors, oncologists, that those people who are having the strong habit of smoking, chewing tobacco, and heavy drinking of alcohol, using nicotine, alkaloidal content, all these factors, they are mainly responsible for mouth cancer. But at the same time, they will also say, according to statistical data, that there are more than 50% people who have never smoked, who have never used tobacco, who have never chewed any cola nut or dali supari, but still they got mouth cancer. The reason is that is not that only tobacco chewing or smoking of cigarette is related. The main factor, what it is related to mouth cancer, is called irritation. Main factor is inside your mouth, whether it is upper floor or lower floor of your mouth, or your tongue or gum, anywhere, even your teeth, if they have any chance of irritation by any means, that can cause cancer. So, the only linking to tobacco or smoking or alcohol or some other bad habits is not the only factor. Of course, tobacco factor is there, where some people in India or even in other places, they take some particulate of cola nut, and those small particles, they are stuck to the teeth and they remain for 1 or 2 days time, and they are responsible of triggering. The same for dali and pan in India, and some of the people who are taking some tobacco leaves in powder form, and they will put under their this lip like this, and they will hold it for whole day or few hours. That is triggering factor. So anything inside mouth which is causing triggering factor means where the upper layer inside the mouth, they are cell, and cells are irritated, and once the cell inside the mouth are irritated, they will mutate, they will change. And of course we all know that every human being is the carrier of cancer cells. Cancer cells are always floating in our body, but at this point where because of triggering, immediate production of lot of abnormal cell starts, and once it is multiplying very fast, then it can overcome to our normal cells. That is the factor, that is triggering factor. And nowadays people, they are not understanding very well that what are the triggering factor in this modern age. Many factors are there, and that belongs to dentistry also. When we are going for our dental treatment, extraction of teeth, again there may be triggering factor, because the other teeth, when it is fixed, sometimes it is not properly fixed and your biting position is not correct, then always there is triggering factor. Also, to make teeth alignment, for that they are putting metallic wire. So inside our mouth, any foreign material which is metallic is again triggering factor. And all these things, triggering factor, doesn't mean that it should pinch. It is there inside mouth, but automatically it is triggering yourself as a foreign material. And the first symptom, what you will get, that inside mouth, even around your lip, some frequent inflammation, that is called swelling. Some patches, white patches, are formed inside your mouth or on the tongue. So these are all the first sign and symptom that there is problem, and it is towards mouth cancer. And also nowadays there is one test that is called three-finger test. Three-finger test means you take your three finger like this, and whether your mouth can open and accommodate your three finger or not. And if it is not accommodating, it means the flexibility of your these two jaw, one is fixed and lower one, they are stiff. They are not that much flexible, and one they are losing flexibility, and other cause may happen. There may be sign. So like this, at least my three are going, but some people they cannot. They have only space of two. But if it is three, you can put three. That is called three-finger test, and then your jaw goes like that. Means it flexibility is normal. There is no any stiffness, and when stiffness starts in your opening of the mouth where you cannot enter three finger, even it goes up to that extent. If really there are a lot of cancer cells are multiplied inside and then comes to your back neck, it will be difficult for you to open the mouth. Secondly, your speech, your vocal frequency will be drastically changed. You will start losing your breath without any reason, and always you will be feeling weak. So these are all symptoms. Again, always very frequent around your lip, there will be inflammation and swelling. So these are all, I can say, first symptom of towards mouth or oral cancer. And today it is reported in the world that up to 5% people they suffer from mouth cancer, and this mouth cancer mainly, according to statistical data, it happens after the age of 60. Otherwise, it is common when some people are above 70 and they are not taking care, and especially a lot of particles are held up and they are triggering inside the mouth. That's why proper brushing, and also we have to use some nano type of very small such type of brush. I will show you the image, which can enter inside the two spaces to clear and to push out the small particle. And for toothpaste, there are hundreds of type of toothpaste and tooth powder. You should not be concerned. Only you should be concerned its particle size. Particle size is very important. And nowadays, for teeth whitening, people they go for charcoaling. Charcoal powder is also sold. That is charcoal powder. This charcoal powder in our childhood, I know in our villages in India, koila. that the black piece of the burning wood, that one, the same thing, it is charcoal powder. It is sold in the market now, and people bring, and that is, they are using it to decolorize the teeth. Means if the teeth is having some dull or yellowish color, they do charcoaling. But not only up to that extent, people, they go up to that extent to make it white shining, and for that they are going and using hydrogen peroxide or some bleaching agent, bleaching chemicals. Lot of different type of chemicals are used inside mouth. For example, it is a very common practice nowadays. When you go for any dentistry problem, extraction of teeth, or maybe for your RCT, root canaling or capping, then dentist will prescribe orally, you take mouthwash or mouth freshener. They are all containing different type of chemicals and alcohol. So if regularly you are using that, it means inside your mouth there are two type of bacteria. Inside your mouth there is saliva. Your digestion starts from your mouth. And if you are regularly using every day mouthwash, some people, they have such habit that after their dinner they will say that, no, I am using mouthwash. Is wrong. You are, because why they are using? Dentists, they have recommended that all the bad smell, foul smell from our mouth will go. And bad smell in your mouth, what you are getting, is not because of mouth, it is because of your gut, your digestive system. Because of that, if you are taking lot of acidic food, amino acid, protein, or animal product, and your gut bacteria, they are not properly working, then you will get acid reflux, and that acid reflux will come in the form of bad smelling. So for that, please don't use any this mouthwash, because they are killing your good bacteria also, which are responsible of when you are chewing your food, to mix it with your saliva, and all this will be disturbed and your mouth will be dry. That is called dry mouth. Means you have less quantity of saliva, alkaline, that is very much useful. Your digestion of the food starts from chewing. There the positive bacteria and your lot of enzymes, hormones, they are mixed, and then you are going to slowly swallow it. But now people are not chewing much, 30 to 25 times. Rather than they will swallow, just 2-3 times take and then it go inside. Is wrong practice. That is also reason. And let me make it clear. Your lung cancer, colon cancer, or other cancer, they can be related to your mouth bacteria and your mouth hygiene, because it goes inside and they are responsible of causing your organ problem also. So the mouth health or oral hygiene is very important if you want to protect from cancer. And my understanding is that, to be very frank, I strongly believe that in medical science there should not be advertisement, because we cannot see advertisement of wheat and rice. It is needed and demand. So once somebody is doing the advertisement of lot of things, for dentistry, for cosmetic surgery, for plastic surgery, for jaw upliftment, for symmetrical and beautiful face. For example, another factor nowadays also is there, that is called cosmetic surgery for smiling. We have 3 types of smiling now. Before it was only one smiling, natural, aesthetic smiling. We are talking, we are laughing, we are enjoying. If something is good, we are happy, we are smiling. Then other type, that is called contact smiling. Contact smiling nowadays, that is in film industry, showbiz, entertainment industry, where people are saying, no sir, I have seen in camera, when you are smiling, it is not attractive. So for that they will go and adjust their teeth and jaw and minor surgery, and they will put some metallic wiring inside so that when they are laughing, many people are happy. That is also another very, we can say, bad. For greed and money, you can go to any extent. And also advertisement is there. Lot of our film hero, actor, actresses, they will advertise for pan masala, for tobacco, for cigarette. And actually what advertisement they are doing, they are showing that they are eating pan masala. That is not pan masala. They are taking maybe coconut powder or some other very good vitamin powder. And they will show that this is pan masala, and they are happy and they are jumping. This all advertisement is marketing. So don't go by marketing, don't go by advertisement. And the third one, smiling, that is called marketing and commercial smiling, means if you are doing job in hospitality industry, in hotel or restaurant, to please the people and to accept the customer, you have to smile. That is plastic or synthetic smile. So in industries, lot of such type of things are happening. They are contributory factor for mouth cancer. And again, the second point is, that is second is immune system. Anybody who is diagnosed any type of cancer, whether it is mouth cancer, oral cancer, colon cancer, lung cancer, liver cancer, whatever, it means that their immune system is compromised, immune system is weakened. So always take care of immune system. Your immune system is your doctor. Your immune system is oncologist. Your preventive measure is the best treatment. That's why I mean, my understanding and my recommendation that in every city there should be the center of preventive measure. If somebody is having any doubt or any first sign or symptom of anything where it gives doubt that there may be such type of cancerous growth, he can go to preventive center. Rather than once you have got the cancer, the game is over. You have got cancer. Before getting that, you have to take the preventive measure. And once anybody who is diagnosed mouth cancer, their timing is from 1 year to 5 years. Even some of them, if it is stage 4, they cannot survive up to 6 months. So there should be center where they can take care and they can advise, they can handle for preventive measure. So for preventive measure, only 2 things I am always telling. Please take such type of food which are rich in antioxidants. Antioxidants means are those compounds, are those phenolics which are capable of scavenging, damaging, destroying the production of free radicals in your body, and free radicals are produced in your body during the oxidation, reduction, reaction. Your body is nothing but reaction, just like industry. So you have to control the reaction. The biological waste, whatever biological waste is produced, if that one is taken care, is removed, at least in that the multiplication, mutation of the cells will be drastically reduced. Secondly, take such type of food which are having anti-inflammatory compounds. Anti-inflammatory compound means omega-3 fatty acid, rich source is fish, the whole grain. Those who cannot take fish, they should go for capsule. Omega-3 capsules are available. So measures, lifestyle will improve your immune system. Second, don't compromise your sleep. If you are always compromising your sleep, you are playing with your immune system. Your immune system will be weak. Immune system you cannot improve by taking some capsule or tablet. It is your lifestyle. Once your immune system is strong, lot of things are happening inside your mouth. All those things. And your these cells which are fighting for you, they are strong enough. They are enough to destroy them and to digest them. So these are all very, very important factors. And once we are taking care of all these measures that may give the signal or cause of this oral or mouth cancer, you can be prevented. So below your ear and thus on your jaw, if you put 3 fingers and you open your mouth, you get pain. It means you have to be careful, and it shows that your jaws are becoming stiff and it is losing flexibility. That is another problem, and you can take still the preventive measure. This is very clear picture of that is called 3-finger test. In your mouth, if you can put this 3 finger by opening your mouth, it is okay. Flexibility is normal. But if it is not possible and it goes to 2, then you do the exercise. I will show you so that your jaw muscles are strong and they are flexible. It's very important because stiffness is causing the problem and that may lead to mouth cancer. So arrow is showing what is clockwise, anti-clockwise movement of your lower jaw is a type of exercise where your joint of the 2 jaw will be flexible, it will not be stiff. The other one I am showing this here, another exercise with your tongue you can roll down inside, so your upper and lower floor of your mouth is also having some exercise. Here you can see very clear picture inside all the teeth. There is some wiring of metallic wiring, and just to make the teeth align. And this is another triggering factor which can irritate inside the mouth, and that is also one of the reason irritation, and that can cause mouth cancer. Nowadays here it is very common, the metallic wiring of the teeth to adjust it for giving the beautiful smiling. So this type of all the cosmetic and marketing is not good because it will again irritate inside the mouth, and irritation is the main factor of mouth cancer. And this is very important. Once you have some spacing between 2 teeth, this is nano type of toothbrush that will go in between the 2 spaces, rather than using lot of dirty wood piece or some other thing, or maybe some type of thread to remove the waste material is wrong. Please buy this, and if there is anything wrong, quickly you can put inside your space of the teeth and it is removed. You can see how it is used. That lady is putting that nano brushing, and that will go inside the spaces, and whatever particles are held up, that will be washed out, and your inside mouth, the irritation particle will be removed. So in summary, I have written here, number 1, tobacco use of any kind, including cigarettes, cigar, pipe, chewing, tobacco, and snuff is one of the cause of irritation in the mouth, and that irritation finally converts into mouth cancer. Heavy alcohol use, excessive sun exposure of face and mouth. Once you are working under direct sunlight and your face is always facing your sunlight and your mouth, that is also one of the irritating factor. That is face and mouth. Sexually transmitted virus called human papillo invirus, and it is commonly called HPV, that is human papillo virus. Human papillo virus causing the cancer, even up to mouth cancer, some other cancer. That is common in Africa, but of course it happens everywhere, but mostly it is common in African continent. And also the compromise of immune system, that I have already told you in detail. Number 2, you will get first sign or symptom, and once you get these symptom, you consult your doctor, first your dentist, or if it is going up to throat, then ENT, ear, nose, throat, the one who is expert. First is a lump in your neck. Actually, if there is any problem here inside and your jaw is having the lump formation may start from here, stiffness. That's why 3-finger testing is very important. Neck, loose of teeth. Your teeth will also be loose in the socket. So loosening of the teeth is also one of the sign. Then changes in the speech. I told you that your vocal frequency will be changed because your tongue and all this will not be in a normal place. Numbness or bleeding inside the mouth. Inside mouth sometimes you will feel numbness, and gum or some from teeth side there will be bleeding and without reason. That bleeding means it is a sign. White patches inside the mouth or on tongue or on gum. I have already told you all this. And then unexplained weight loss. Number 3, if mouth cancer is in advanced stage, it may be hard to recover. That's why preventive measure is the best. And your willpower, your immune system, they are recovering you. And as a chemist, medicinal chemist, please maximum avoid synthetic drugs, whether it is antibiotics, sulfur drug, painkiller, anything. Take preventive measure natural. And natural means lot of natural products are there. Exercise is there. Hydration is there. Foods are there. Anti-inflammatory foods are there. Antioxidant foods are there. Go for that. Rather than immediately you just go and meet the doctor and they don't have deep knowledge in medicinal chemistry, they immediately prescribe antibiotics. 90% cases now, whatever happens, antibiotics. And lot of antibiotics, they are now resistant. Because since last 40 years, some new drugs are not available. A lot of new research is not done. So avoid up to the last moment any synthetic drug. On tongue and weight loss, and if mouth cancer is in advanced stage, it may be hard to recover. Up to 70% of mouth cancer survive for 1 to 5 years. And after diagnosis, this is note for everybody. Never go by marketing or by advertisement in any health condition. Because nowadays everything is marketing. Your death is marketing. You are on deathbed. On ventilator, doctors, they keep for 20-15 days so that they can get 2-3 million naira, 2-3 million rupees. Even if somebody is dead, mechanically they will pump and they will show that no, still he's breathing. And this lung and heart is working. Just for money matter. So don't go by advertisement. Don't go for any type of lucrative marketing business in health sector. Please, this is, I consider it inhuman and crime in health sector. And medical condition here, life is involved. So stop health advertisement. Money making in health risk is dirty affair. And now I am sorry because I am traveling India and foreign other countries, America. Oh, health sector. I mean, I cannot share my experience, very bad experience. If somebody is sick, rather than showing sympathy, first they will ask, have you brought the millions of dollars or millions of rupees or millions of naira? To be very frank, we should have such type of provision so that all these chronic diseases, organic diseases should be treated free of cost. In India, there are some NGOs and some charity organizations like Tata Institute, Fundamental Institute that is for cancer and some eye operation. They are all doing free. So such things should be there if we are human being and if we belong to human face and same human colony. So with this, I will stop. Thank you very much for watching the lecture.